My name is Maria Bourgeois, and this week the patient present with knee pain. The differential diagnostic are the medial meniscus tear, medial collateral ligament sprain, anterior cruciate ligament sprain, and tendinopathy of the pars anteriors. The first thing I'm going to do, I'm going to go ahead and start with inspection. For the inspection, I'm going to be observing both knees for any scars and any lesion, any discoloration, any abrasion, and so on. So, as I can observe both of her knee, I don't really see any scars, any lesion yet. I'm also going to be observing for any asymmetry, any swelling. All the swelling over the patella and slightly flex the knee. Okay. All right. Next, we're gonna start with bony palpation. We're gonna do the patella of the knee. So I'm gonna start palpating here at the patella. And then we're gonna go to the medial plateau, medial tibial plateau. For the medial tibial plateau, I'm gonna have you extend your knee outward for me. So that will be the medial tibial plateau. Okay, now I'm gonna have you rotate your knee inside. We're going to go to the lateral tibial plateau. Okay, so next we're gonna move on to the medial, here to the medial femoral condyle. Should be right here. Then we have the lateral femoral condyle right here. And then we are going to move to the fibular head right over here. And then the tibial tubercle. Next, we're gonna go ahead and start for the soft tissue palpation. For that one, we're gonna go ahead and start with the quadricep muscles. Next, we have vastus lateralis. Then we have rectus femoris. Vastus medialis, and then we have vastus intermediate. All right, next we're gonna palpate the prepatellar bursa. All right, then we go down here to the infrapatellar tendon. Then we're gonna slightly move over to the superficial infrapatellar bursa. We're now going to move the foot slightly anteriorly, and then we're going to find the lateral meniscus. And then we're going to move the foot slightly anterior to find the joint, and we're going to do the medial meniscus. Now palpating the lateral collateral ligaments. And then we're going to move on to the medial collateral ligaments. I'm now going to palpate the pars anserine. And then we're going to palpate the three muscle affiliate with that. We're going to start with the semitendinosus. Then we're going to palpate the gracilis. And then we're going to palpate the sartorius. I'm now going to palpate the papilloidal fossa. And I'm going to move on to the gastrocnemius, and I'm going to palpate up. We're now going to start with a range of motion. We're gonna start with the knee flexion, 135, and then we're gonna move on to extension, 0, and next we're gonna do internal rotation, perfect, and then external rotation. Good job. We're now going to move on to different tests for the knee. First thing we're gonna start is McMurray test. For the McMurray test, I'm gonna go ahead and contact the patient medial meniscus, and I'm going to contact knee right here. I'm going to externally rotate knee, and I'm going to bring it down. Next, I'm going to also contact the lateral side of the knee, and when I internally rotate and then bring down. So for positive will be clicking sound or pain of the knee, which will indicate when I contact the medial side and I externally rotate it, there will be a tear in the medial meniscus, and or when I contact the lateral side and I internally rotate, there will be a tear on the lateral meniscus. Okay, I'm now going to move on to the medial collateral ligament test. Alright, so I'm going to basically support the knee this way. I'm going to slightly flex the knee and I'm going to push in. That's the medial collateral ligament test. A positive for this test will be gapping or pin of the knee, which will indicate a tear of the medial collateral ligament. Okay, I'm now going to perform the lateral collateral ligament test. I'm going to slightly flex your knees. I'm going to go into the joint, and I'm going to slightly push outward, stressing from medial to lateral. And a positive will be gapping or pin, which will indicate a tear in the lateral collateral ligament. All right, we're now going to perform the bounce home test. I'm going to slightly flex the knee just like so, and then to drop it. Okay, a positive will indicate that the knee does not go into full extension, which will indicate a diffuse swelling of the knee or fluid accumulation. I'm now going to perform the drawer test. I'm going to be sitting right here, right on the patient foot, and like my fingers right behind her knees. I'm going to be pulling. Okay, and the next part here, I'm going to come right up here, and I'm going to be pushing it. That would be the Joyce test. Now, a positive will be whenever I pull the leg, there will be a gap pin that's greater than 6 milliliter, which will indicate a torn ACL, and gap pin greater than 6 milliliter when I push the leg, which will indicate a torn PCL. I'm now going to perform the Lachman test. I'm going to bring, slightly flex the patient. Right here. I'm going to pull away. Okay, positive of this test will be gapping of the tibial moving away from the femur, which will indicate anterior cruciate ligament or posterior oblique ligament instability. I'm now going to perform the apprehension test of the patella. So I'm going to come above and below the patella. I'm going to stress and press near the patella. All right, a positive of this test will be apprehension, distress of facial expression, contraction of the quadricep, and that will indicate chronic patella discoloration or predisposition to dislocation.